I'm very proud to introduce Isabella Chu. She's a population health professional who focuses on risk management, systems integration, and the acquisition of high-value health data sets for research in population health. Now, she's here purely as a representative of herself, not of her employer. Her personal policy interests focus on the impact of housing and transportation policy on health and equity. And she received her master's in public health from UC Berkeley. Go Bears! Okay, take it away.
Hi, everyone. Nice to meet you. Thank you so much for that introduction. And I'm just going to share some slides. Sorry, just dumped a cup of water. Our water's empty now. So let me put this in display mode. Oops, actually gonna have to a little trick. Hang on a second. Let me share my screen and then share desktop to share, and then are you guys seeing
Yes, we are.
Okay. So what I want to talk about is road deaths and injuries and deaths. And it's basically a public health crisis that's been largely neglected relative to its impact on population health. My name is Isabella Chu. I'm I'm a public health professional, and this is my particular research and policy interest. So I wanted to ask some questions. And, since we're a small group, I think rather than just voting, maybe we can talk about our stories. Has any of you had a member of your immediate family seriously injured or killed in a car crash? I just wonder, like, among the 5 of us here, has anyone had someone in your immediate family hurt seriously or killed in a car crash? Interesting. Okay.
Okay,
Okay. Elizabeth?
Elizabeth first.
Okay, yeah, I had a nephew who was seriously injured in a car crash, and he has a brain injury. So and that happened when he was 20, we'll say. So yes.
Yeah, okay. All right. Has a member of your extended family ever been seriously injured or killed in a car crash?
My godfather.
Yeah, and I guess I should answer it number 2, not number 1. Because it was not my nephew, not my immediate family.
It wasn't like nuclear family, it was like, extended family. Yeah, okay. Has a close friend or colleague ever been seriously injured or killed in a car crash? Or somebody, somebody you work with, somebody you worship with, somebody in your circle? Yes. Deborah.
Sorry. A poet that I am friendly with was on her way back from a poetry conference and was close to Cedars and was what do they call it when they go right into the right-hand seat of the car?
Shotgun?
Yeah, I don't know for sure, but she was seriously injured.
Mm-hmm. Yeah, and my neighbor was in a crosswalk when a truck driver made a left turn right through her.
Was she killed or did she live?
She was killed.
Yeah, I was gonna say a truck going through you is likely to be the end of that.
He says he saw her, but just assumed that she would walk faster. She's an 86-year-old woman.
Yeah, that. Okay. Has a classmate or work colleague been seriously injured or killed in a car crash? So it sounds like, Grace, your story. Then finally, has a close friend or colleague ever had a family? So like maybe not you personally, someone or someone you're close to, but someone or you're close to has had these tragedies happen. And so I think among all of us, I personally have had every single one of these things happen. And I'll talk a little bit about my story and my experience, but So basically, like all public health problems, the distribution of the burden of any given public health problem is disproportionate. It tends to impact lower income people more, people of color more, and rural people more than urban, like wealthier urban communities. And so just my story, my mother, when she was about 12, was crossing El Camino Real in Southern California to get the school bus, and the driver went around the bus and clobbered her, and she spent several weeks in a coma, had permanent injuries. My brother, we were visiting Southern California from my home. I grew up on a farm in Eastern Washington. We were visiting, and my brother was riding his bike in an alley, and a driver hit him. He rolled front, and he was seriously injured. It was hit and run. She sped off. My cousin, when he was 6, was walking on a sidewalk. You know, that was back when kids walked to school, and he was killed by a driver. When I was 6, I was probably like about 13. My cousin was 16. You know, and where I grew up, there's no other way to get around except for driving. He was drunk. His passenger was killed. So although it wasn't him that died, it was, you know, that really affected our family. He lived, you know, kind of on our property and with our family. And then my aunt had her 4 children in the car, and they were back-ended by an elderly driver who had some sort of cognitive issues, and she had permanent pain. And from that grew an opioid addiction. And over time, that basically debilitated, you know, the pain, and then the way the pain was dealt with was very debilitating in her life. And so even though she didn't die, she had permanent pain. And it eventually cost her her life many years later. And so, you know, there's been a lot of crash injuries and deaths in my family when I was pretty young, before I was 16. And then rural communities have much higher rates of road deaths than urban communities for a variety of reasons. There's more vehicle miles traveled per capita. You're further from help. Like if something bad happens, it's a really long time before you can get to a hospital. It's typically not a fancy urban academic medical center. It's kind of like whatever you got. And so we had a really high rate of road deaths in my high school. We lose a few kids every year. And a couple situations really stand out. There were 2 brothers, and they were drunk. You know, teenagers do dumb stuff all the time. And there was a crash, and they were both killed instantly, and their mother went crazy because both her children were killed in the night. So that really stands out as like, this is the price of road deaths. So that's my experience. Grace, you had a question?
Yeah, that thanks for the reminder, because in my high school sophomore year, 4 sophomores died all in the same car. They just drove off Highway 92 on their way to on their way to Half Moon Bay. You know, it's all windy and inexperienced, and they just drove right off.
Kids do dumb stuff, like a lot. Like their frontal lobe is not fully developed. Cars are very powerful, they're very fast. Kids are often drunk or talking or having fun or just dumb. Like kids do dumb stuff, and normally that's fine. But in a car, it often proves to be lethal to themselves or to other people. And so you know, I think most people in America are no more than 1 or 2 degrees of separation from a really horrific crash, death, or catastrophic injury. And so what I really want to emphasize is, even though I'm going to share a lot of, you know, facts, data, statistics, road injuries and deaths are very personal. Like they're people's children, they're people's mothers and fathers and husbands and wives and aunts and uncles and nieces and nephews. And, you know, these pictures of our pretty high profile road deaths in the past few years. They're ones, you know, that have made news in my area. You know, each of these got quite a bit of coverage, but there are tens of thousands of these events every year in the United States, and there are millions of injuries. So I want to emphasize, like, these are not rare events. They are a steady drumbeat of deaths and catastrophic injuries that our transportation system needs out. And I want to emphasize as well that these are like, you know, how can I say it? People die and sometimes tragedies happen. You know, a child gets cancer or a loved one has, you know, a chronic disease, takes her life. But the nature of road deaths is that they are sudden, traumatic, violent, and very often completely unexpected. Like, you know, my little cousin, he was just walking to school. Mom was just crossing the street, doing something very ordinary, and their life is either catastrophically altered or ended. And so this really motivates me, not just because of the statistics, but the stories behind this. That there is immense grief associated with every one of these deaths. I just want to talk a little bit about the people that I've talked to and consulted about this. One of them was Stanton Glanz. Stan Glanz is the person who got smoking out of bars, restaurants, and our public places. He's a premier, he's I think a professor of epidemiology at UCSF, that's right, UCSF. Anyway, he's the smoking guy and the secondhand smoke guy. And I really view secondhand driving as very similar in that you've got one group of people who's engaging in a behavior that imposes enormous risks and costs to other people. And not that these are bad people, it's just I don't think people appreciate or understand the degree to which driving everywhere all the time imposes enormous risks and costs. Anna Waller and Katie Harmon are at UNC, and they are road injury and death researchers. So I will be quoting them and citing some of their research tonight. So first I'm going to talk about the magnitude of the problem. So traffic, road deaths, car crashes, whatever you want to call it, have been the #1 cause by far, like no close second, of child and young adult death for decades. That did change in 2020 with a unprecedented global pandemic. There have been some changes in patterns of death, and I'll go over that. But just if you look at the last 75 years, road deaths are the 900-pound gorilla of child funerals, and there's no close second. And that doesn't automatically end at 18. You know, it's still like the heavy hitter through the early 30s, and then other things start to kind of take over as people get older. So this is a later paper. So the table I quoted was from the 2019 paper by Cunningham et al. Discussing causes of child death. This is more recent data from 2022. You can see, and I'm just going to point out this spike. This is opioid overdoses, this is gun deaths, and this is road deaths. And so you see that in 2020, guns surpassed cars as the leading cause of child death. Not because roads got safer, but because gun deaths got worse by more. And so I want to make it very clear, it is not that US roads have gotten better. It's that other things have gotten worse by significantly more. But you can look at the area under this curve, like there is just no close second. If you added up all the deaths over the last 50, 75 years.
And then when schools were shut down for COVID, that was when firearm injuries went down because one, there were fewer adolescent suicides, right? And then you couldn't have, it wasn't that?
Yeah, no, actually, suicide, like, we call it deaths of despair. So there's this like constellation of deaths that are either deliberate suicide or just like not trying to stay alive. I mean, that. So deaths of despair among young people. And again, none of this ends magic. This is a chart for like under 19 and under. none of this, like, there's not a flaming sword at 19, like these patterns hold through early adulthood. There was a huge spike in deaths of despair during the pandemic.
Oh,
Just
really?
enormous. And there's been a sustained increase in all-cause mortality from a variety. So there's been a huge spike in deaths of despair. There's been a huge spike in cardiovascular related deaths among working age adults. Like there's just been an enormous spike in all-cause mortality. And there's work underway to kind of disentangle like what all those sources are. But the headline is that road deaths are a huge cause of premature morbidity and mortality in the United States. They were surpassed by guns in 2020, again, not because roads cut safer, but because gun deaths got worse by more. So you can see that road deaths hugely spiked as well, but there was just this insane spike in gun deaths. Any questions about this chart? So I want to talk a little bit too about what I call tombstone outcomes. And so a lot of times in health research, it's very easy to count deaths. It's definitive. The cops are called when someone dies. You know, there's no question of what that outcome is. But when you, and I learned this concept actually from a colleague who studies older people with chronic conditions. And so if you talk to patients who have, let's say, congenital heart failure or congestive heart failure or something like that, you ask them, like, what's more important to you? To be alive or to be healthy? Like, you know, is being permanently disabled kind of, how do you weight that? They care as much about disability as they do about death. And so a lot of the data looking at road deaths, it has a very tombstone outcome approach that they only look at, is someone dead or not dead? And they don't look at, you know, is a 23-year-old now catastrophically injured and permanently disabled? You know, does the wife of somebody who's, you know, been horrifically injured in the car crash now have to quit her job and take care of their spouse for the rest of her life? Like, there are so many catastrophic injuries that occur as a result of car crashes. And these are not really weighted or counted properly. And so you can see these are injuries for kids. There's about 500,000 injuries a year, and there's about 46,000 serious injuries per year. And you can compare that to firearm related injuries. So and the reason, and I'm comparing it also to cancer, you know, so you can think about, you know, kid gets cancer, 13,000 of them live, 15,000 of them die. You know, like pediatric cancer still has a really high mortality rate, just because it's very aggressive. You know, firearm injuries have a really high mortality rate, frankly, because it's a weapon and people are either trying to engage in self-harm or homicide. Road deaths are a little different in that there's a very high injury burden relative to the rate of death.
Oh, can you explain what a neoplasm is?
Cancer, tumor, cancer.
Any type of cancer?
So this is childhood. This is childhood. I think these are kids. I was focusing in on kids. But the point being that if we just count deaths, yeah, it's true. Guns have surpassed cars, sure. If we're looking at the whole picture of disability adjusted life years or years of life lost, cars are still crushing every other cause of long-term disability, serious injury, etc. So there are a lot of problems in how we think about this problem. So one of them is data issues. So the way we measure, count, and think about injuries and deaths is to look at police data and link it to health data. So there are several shops that kind of do this. They're able to get what's called a FARS report. Basically, if some crash happens, the police get called and then they fill out a report. And then for most states, basically these data are very protected. So you have to probabilistically link them to health records and then kind of follow people and see what happened. And so this research is really hard to do. So one of the most important things we could do is sort of argue for transparency and linkability in police reporting of crash injuries so that we can do really good linkages. But something important to understand is most of the counts you see of injuries and deaths. And so for deaths, it's pretty accurate. If someone dies, the cops are almost always called. If someone's hurt, very often they're just taken straight to the hospital, particularly if they're on foot. If they're not in a car, they're just taken to the hospital and the police never get called. And so what they found was police reported crash data underestimate injury severity. And I blame police for a lot of things related to road safety, but I don't blame them for that. They're not medical professionals. A lot of road injuries are blunt force trauma. They're things like TBI, traumatic brain injury, spinal cord injury, internal bleeding, things like that. They're just not equipped to measure or diagnose those kinds of injuries. So basically, police underestimated the rate of serious and severe injury for pedestrians in particular by about fourfold. And then the other thing too is that quite often police are not even called. And so very often the estimates you see on pedestrian injuries are off by orders of magnitude. Grace's question.
Yeah, I was reading Killed by a Traffic Engineer, and in one of the footnotes, he talked about dooring and how because the vehicle is not moving at the time that they open the door and knock the bicyclist down. And the door edge is kind of like a knife edge if someone is traveling fast in a bike lane. That's not counted as a traffic injury or death.
Yes, and I'm gonna go on to talk about that, but there's a lot of things like that where, and again, I never want to attribute to malice what could be attributed to like indifference or incompetence. But there's a lot of undercounting of these injuries and deaths. So one of the ways that they're undercounted is if somebody is, hit by a car and they're on foot, the police aren't even called, they're taken straight to the hospital. If the police are called, the police are not very good at estimating the degree of injury. They undercount it by about fourfold. So, there's serious problems with the data there. And then another measurement problem, in addition to what Grace just pointed out, is that our NISTA, which is the National Highway Traffic Safety Administration, and the police and things like that, count road fatalities and injuries per 100 million vehicles miles traveled. And the problem with that is that you're measuring the hazard from the point of view of the hazard. And let me give you an analogous situation. If you looked at gun injuries and deaths in America and said, you know what, we're not going to count shootings and we're not going to count deaths per capita. We're going to count deaths per shooting. If you compare deaths per shooting in America and deaths per shooting in Sweden or France or any other country, you'd probably get about the same numbers. Given that someone's shot, somebody in America is about as likely to survive and maybe even more likely to survive than somebody in another country. And if you looked at it that way, you could say, well, actually, America doesn't have a gun violence program, or problem, because given that you're shot, you're about as likely to survive here as you are anywhere else. That would be ignoring the incredibly high rate of being shot in America. And if you measured it that way, you could say, actually, we don't have a gun violence problem. And if that sounds insane to you, consider that that's actually how we measure road deaths. We measure it per 100 million vehicle miles traveled. And so as the dose of driving goes up, the rates of injury and death go up. But the way it's measured is they divide by the amount of driving, not by the population. And the way we measure every other hazard in population health is you look at how likely is this thing to end a human life, or how likely is this thing to permanently injure somebody. And so another way that there's serious data issues and serious measurement issues is that it's measured from the point of view of the hazard and not from the point of view of the person. Is there any questions about that? All right. So I'm gonna just show you how insane this is. So if you look at this, you know, again, this is going back to vehicle miles traveled in the upper left-hand corner. So you can see, oh, it's pretty flat, it's pretty okay. But this is what it looks like on the ground. As every other wealthy nation in the world basically has a declining rate of pedestrian injuries, US pedestrian injuries are skyrocketing and have been for about 15 years. And yet NISTA is claiming there's no real problem. Same with overall injuries. Again, you know, if you look at this, this doesn't look too bad. You know, the dose of the hazard is going up. You know, again, if you went back, you know, smoking, shootings, like if the rate of smoking is going up and you only measure like rates of lung cancer per cigarette, you could say, well, we're doing pretty good. The rates of smoking have doubled, the rates of cancer have doubled, but our rates per cigarette are on par with other countries. In the same way, our road deaths are skyrocketing relative to peer nations, and we continue to measure it from the point of view of that. Any questions? Yes, Grace.
Are we above Russia with all their drunk driving?
Yes, we are. We are number one.
Oh my God.
No, we're the worst. We're really bad. And actually, Los Angeles is among the worst of the worst. California is actually really, really bad, particularly for pedestrian safety.
Yeah, I know that I know that California is about in the middle and LA is really, really bad amongst large cities anywhere in the world.
Yeah, 55% of the road deaths in LA are people on foot. Slaughtering pedestrians. Yeah, so the US is an outlier in road deaths the way it's an outlier in gun deaths. So then, you know, going back to this measurement thing, the way we measure things in population health is from the point of view of the population. How likely is this thing to create injury, disability, or death per 100,000 humans? Number one. Number two, we look at something called disability adjusted life years or years of life lost. And so really important way that road deaths are different than other kinds of deaths is they kill young, healthy people.
Team onboarding.
So, I'm sorry?
In this program overview, we're going to take a
Who has,
Oh, that's okay. So an important difference is that we measure road deaths from the point of view of the hazard. And so for most things, we would look at, does this thing kill a lot of young, healthy people? Does this thing kill, you know, people kind of in the prime of life? And road injuries and deaths tend to be sudden, violent, and disproportionately kill young, healthy people who have, you know, 20, 40, 60, 80 years ahead of them. And as a result, they have they're disproportionate years of life loss. Yes, Elizabeth, question.
Oh, thank you. Okay, I'm sorry, I'm reeling with the way this is measured, and I guess I was gonna wait later, but who came up with this? I mean, it's just so backwards. It's,
Yeah.
I'm
Yeah.
like, I'm floored, I'm speechless. It's just,
Elizabeth, I have a book for you. I'm 40% of the way through. When I'm done, I'll give it to you.
okay, okay, thanks.
And he actually explains it. It was the president of Studebaker who didn't like the statistics presented the way that Isabella would, a population health person would do it. And so
Okay.
in order to sell more cars, they convinced the US government to use the VMT one.
Oh,
It was a car company.
Yeah, I'm gonna get into that a little
okay,
bit. There's another area of public health where we measure deaths from the point of view of the thing doing the killing. We measure it in every other domain. We measure it from a population perspective, deaths per 100,000, disability, you know, disability adjusted life years, things like that. In road deaths, we measure it from the point of view of the hazard. Number one. Number two, we only measure deaths. To a very large extent, the measurement of injury is very blunted. There are people working on that, but it's not measured well. And we don't have good measures of secondhand driving exposure. noise pollution, particulate matter. I mean, there's a lot of really interesting work going on pollution. Actually, that's one of the most cutting edge areas of research, but it's again typically measured from the point of view of the car. And then the thing that's not measured at all is the displacement of walking, biking.
And Wesley Marshall, who wrote the book that I'm reading right now, he actually wrote a paper on that using biostatistics to explain how you suppress walking. He looked at school children, and he looked at how the volume of traffic, the speed of the traffic, how loud it is at the sidewalk. And he was able to come up with parameters on how cars suppress walking and cycling to school.
Yeah, and I'm actually hoping to, if submitted a grant, I'm really hoping to assemble some data where we can really take a hard look at some of these.
Oh, and work with Wes, that would be awesome. I would love to do that in California.
Yeah, and then I've emailed him, once we get the data, if we get the grant, once we get the data assembled, I'll reach out and say, hey, we're ready, you know, if you wanna.
Yeah. Yeah, he did that for Denver because Denver gave him a grant to do that.
Yeah, so there are measurement issues. The next is culture issues. And from I'd say, so if you think about the way our transportation system evolved, from the 20s, cars were like the playthings of rich, wealthy, largely men. And again, I'm not anti-man, I'm not anti this or anti that, I'm not even anti-car. I just want to kind of go through like how things got the way they are. And so a lot of the laws that were written around traffic and things like that were written in the 30s, 40s, and 50s. And if you think about who had cars during that time and who didn't, and the disparity, the social disparities there, those have become embedded in our transportation system. And basically disparities are deeply embedded in how we measure, count, and think about transportation. So I'm giving this as an example. These are what's called warrants for signals, like traffic signals. And so this is the minimum number of reported crashes in a 1-year period. This is per intersection per year, and it's a minimum, not a maximum. So you can have up to 10 crashes per year. And these are injury crashes. Up to 6 for 4 legs and 6 for 3 legs.
So those are leg amputations.
These are injury crashes. This is car hitting a pedestrian. These are minimums before you can consider a traffic signal. Not only are they minimums, but they're minimums before you can consider a traffic. So they have to be, it has to be proven that this crash wouldn't have happened had there been a traffic signal. What do you guys think this signals about the relative weight given to pedestrian safety versus motorist convenience? I'd love to hear a discussion. Like, what is this signal about the weight given to those two things?
Cars are more important.
More important than what?
Pardon me? Than,
More important than what?
than people who are walking and pedestrians.
Yeah. Any
Mhm.
other thoughts on
And
that?
so, sorry.
I had talked to our, not our current public works director, but the one who retired, about getting a traffic light at an intersection. And he said, well, if there is sufficient people, we'll have to do a traffic study. But if there aren't sufficient people attempting to cross the street here, and this is Artesia Boulevard with 40,000 vehicles per day, he said that if there aren't sufficient people trying to cross here, then a traffic light isn't warranted. And I said, well, there's half a mile between stoplights. So yeah, it's warranted. And he says, no, because we've done less than 2 years ago a traffic study, and people aren't trying to cross here.
Not enough people have died, basically. And so what you need is a lot of bodies, like a thick stack of bodies, and then they can think about it. And so what this really codifies is that the convenience of a motorist, the convenience is weighted much more heavily than the life of a person on foot. And this has been endemic in transportation policy in the United States since the 20s. And if this sounds insane, this was in the 1935 NUTCD, which is the book that kind of, it's the book that a manual of uniform traffic control design. It's the official book that determines how US roads are designed. These charts were in the 1935, and basically, I think a bureaucrat was basically spitballing and said, the deaths of about 10 poors is fine versus inconveniencing a little rich guy. Almost 100 years later, the AASHTO, which is the engineering professional association that writes this book, got over 30,000 comments saying, for the love of God, change this. They didn't change it. These tables remain unchanged in 2023. And so something you need to really understand is that it is endemic in US transportation policy that the convenience and the property of the motorist is prioritized above the mobility, health, safety, and life of anybody outside of the car, and to an extreme degree. And these tables are really emblematic of that, but it's embedded into virtually every policy and design choice. So continuing with cultural issues. So this is the 2021 Community Development Quality of Life National Award winner for the American Association of Highway and Transportation Engineers. This is not a joke. This is actually what they posted. They were dragged and pilloried relentlessly for this, and the next year they didn't post their winners. But think about what this communicates about policy preferences. Think about what this communicates about priorities, and who's important and who doesn't matter at all. And if you think this is an anomaly, this was large project. I think there's a bike lane maybe here. There's a bike lane somewhere in here. This was the medium project and this was the small project. These are quality of life and community award winners from the people who design our transportation system. And so I just want you to take in like what this communicates about priorities and values. There's cultural issues, blaming people who are hit, hurt, and killed by our transportation system versus the people, basically from the 20s onwards, the automobile industry made a very focused, concerted effort to shift blame from the people doing the killing to the people doing the dying. And that is endemic in a lot of departments of transportation, messaging, NISTA, all of these organizations. The idea is if a motorist hits somebody or something with their car, it is the fault of the thing being hit. It's not the fault of the engineer who designed a street, so that's a very likely outcome. It's not the fault of the person driving negligently. It's the fault of the thing doing the dying. And this is very much embedded into messaging, into design standards, and into everything that our transportation system does. So that's also a serious cultural challenge. Any comments or questions about these?
Well, again, it's just amazing. It's, and it's, I see this. I mean, it's still shocking though, that it's, the car and the vehicle and, big oil just rule so much. It's just really sad.
It is. And, this one particularly got me. You've got kids on the sidewalk and they're like, hey kids, don't get hit. We're an organization with billions of dollars and direct control over the built environment, and you're a little kid walking home from school, and it's on you not to die. And fortunately they got absolutely dragged for this and they wound up deleting it. I got the screenshot before they were pilloried.
how do you, like, kids should be able to walk side by side and chat with their friends.
On the sidewalk, people were like, oh my God, are you? I'm just saying that the culture is so, yeah, so.
It's like the water that we swim in.
Yeah, and so I'm just trying to help you understand what we're up against when we're trying to change the culture, the framing, how we think about how to measure this, how we think about how to talk about it. That dots are very accustomed to blaming the most vulnerable people for their own deaths. To a great extent, they're not able to get away with that anymore on social media. They get pilloried and cyberbullied into deleting those kinds of things. I don't know if they've learned the lesson that they're wrong. I think they've learned the lesson of don't post this. I don't know that it's translated to changes in how they design roads. But
We know just this year, the city of Manhattan Beach banned people from, they wrote this thing where the kids are supposed to, all bicyclists are supposed to ride single file as far to the right as possible. And that contravenes state law, which says that they cannot, that you're allowed to ride at least two abreast. But that means in Hermosa Beach, I saw two parents riding with their two children in between them and taking the lane, as they should, because they were protecting their children between them. And that would be illegal in Manhattan Beach, which is their neighboring city, adjacent city. So that family would then have to turn around because it'd be illegal to do that.
and unsafe. It is so often riding as far right as possible is actually really unsafe. Those people close. But anyway, so the point I want to get to is that like the culture is cars are the only form of transportation that exists. The lives of people outside of cars are forfeit and set to zero relative to the convenience and the property of someone in the car. And that the default is to blame people who are hit, hurt, and killed rather than the system, which makes that a likely outcome. And again, there's no other area in, civil engineering or public health where we really take this approach. It'd be like blaming 9-year-olds for interest rates. If the Fed put out messaging saying, hey, 9-year-old, don't borrow. You're the Fed, you have direct control over this. And yeah, departments of transportation with billions of dollars, direct control of the built environment are doing messaging aimed at little kids saying, don't die because we built you a dangerous environment. If you call this stuff out, you look like a crazy person. I think I talk about this a lot on Twitter. I talk about this a lot. It's just so much the water we swim in that if you're kind of trying to push against it, you seem like an activist or a radical rather than just saying, hey, I'm someone who wants to be able to walk to the corner store without fear of mortal peril. Some things I heard from the researchers I talked to who will not be named, is that NISTA, which is the organization that's supposed to regulate the automobile industry, takes their direction from the automobile industry. There's a notion that autonomous cars are going to save us all, and that we don't have to worry about regulating the automobile industry. And so there's not much of an appetite. And frequently there's not even, like, basically a lot of the research is very report and not academic. And so even the way research in this area is funded, the way it's bounded, really discourages taking a hard look at why our road deaths are so high. So I'm going to talk a little bit about gaps in the research that stem from this culture, the way this research is funded, and who the funders are. Almost all publications are reports and abstracts. They're not really in the academic literature. This is related to funding. Almost all funding for road safety is through NISTA, who takes their direction from the automobile industry. Explicitly, research is often prohibited. It's frequently prohibited to put it in academic journals, and dots are really scared of health data. So going back to that issue I talked about, like my job is actually systems that host high risk data. And a lot of people who don't do this for a living are really scared of that kind of data because you do it wrong, you can go to jail, be fined, and never be heard from again. And so dots really don't know how to handle health data. And so in order to really answer these questions, need to be able to link crash data to high-risk health data. They don't want to touch it. On the bright side, we can make the argument that there's no funding for public health research on the single most important, I think, health risk that young people face. Yes, Grace.
Is it because of the health data is confidential or HIPAA?
Yeah, which again, like there's plenty, I mean, again, this is what I do for a living, like if you're doing science in the public interest and you vigorously protect the data, and we go through immense amounts of work and steps and training and hoops and things like that to protect the identity of individuals. Nobody in health research wants to know who a person is. They just want to know, given this person exists, how likely is this thing to end them or to disable them or to injure them in some important way. But if you're not used to dealing with that kind of data, it's very expensive and scary and labor intensive to kind of design and have systems that host it. So
Oh,
some
sorry, but Wes Marshall's paper about school children in Denver, it was, I think, either the city or the school district paid him to do that research. And it wasn't through transportation.
Yeah, no, and I've been looking for grant opportunities again, I'm really trying to think about where can we find funding for this kind of research. So no shade to the NIH, but they're interested in organs, diseases, and systems. And they're not particularly interested in unintentional injury, which is the leading cause of young adult injury. Basically, the US is an outlier in opioid overdoses, car crashes, and med deaths. And that's why we've got such a terrible life expectancy relative to peer nations. It's unintentional injuries is really what does us in. So other gaps in research, very few people have looked at the noise pollution aspect. So like if you're in any place in the US, any city, the number one source of noise pollution is automobiles. There is a lot of research on blunt force trauma deaths. There is good research on linking, who dies, where they die, why they die. There's a real paucity on looking at the injuries, like the distribution of injuries, what types of injuries, what makes them more likely, and the long-term effects. Again, because it's very hard to get this kind of health data at the national level. Almost all publications are reports. Happily, so there's 4 ways cars kill people. They hit them. They exude tire, brake, and exhaust tailpipe emissions, which give people CVD, asthma, all kinds of stuff because we breathe.
What's CVD?
Cardiovascular disease.
Okay.
Heat, little kids get into cars and die of heat stroke. That's actually extremely rare, but it's another way. And then the number one way is the displacement of walking. And so actually there's really robust research on the particulate matter. Unfortunately, they mostly look at deaths. Again, it's this tombstone outcome thing where they measure the amount of mortality, but I have not seen good studies on the amount of cardiovascular injuries and chronic disease as a result of breathing tire, brake, and exhaust particles. And then finally, the question that remains unanswered, and the thing I really want to answer, before I die and assemble the data and the team to look at this, is how many people die every year? Because we evolved to walk 5 to 10 kilometers a day, and we've created such a hostile system that nobody can do that anymore safely.
Oh, and I just want to say, can you go back? I want to say that speed is related to all of these because above 20 miles per hour, tire noise is the main source of the dominant source of noise. And so the faster cars are going, and then the louder the street noise is. And that also exacerbates blunt force trauma. And it also is implicated in tailpipe emissions and tire and brake particulates.
Yeah, and it's also what makes places scary to walk in. I mean, like if you're walking along a street and all the cars are lumbering by very slowly, it's fine. you know, it's not. Better to have no cars, but if you have a car like rolling by very slowly, it's okay. If you've got cars whipping by at speed, it becomes very unpleasant, very intimidating, and very
Dangerous.
dangerous. Yeah.
Yeah, dangerous and unhealthy. And that's one reason why other countries are limiting urban speeds to 20 miles per hour or 30 kilometers per hour.
Deborah, you had a question?
Yeah, I just wanted to mention that the Journal of Pediatric Psychology in the past has looked at child injuries. Because they're a journal that's focused on kids that are hospitalized. And there may be some data for you there.
Yeah, if you've got good articles, please do send them to me, because like I've got not a sabbatical exactly, but my boss is taking a sabbatical, so my life is a little easier for the next couple of months. And I really want to work on doing a lit review for this particular topic. So if you've got articles, please do send them to me.
I don't have articles, but it's really easy to search for them.
Absolutely.
Yeah.
What's the journal name again?
I'll try and make sure that Grace gives me your email and I'll get you some.
Great.
Okay, it is the Journal of Pediatric Psychiatry,
Psychology.
Psychology.
Great. Just some other areas for study. You know, again, my interest is like injuries, deaths, disability, is enforcement. There's a lot of, so a huge area of activity for policing is traffic enforcement. There's a lot of interest in how that's done, how much it costs, how fair it is, who gets enforced, who doesn't. In automobile advertising, and again, I go back to Stan Glantz. If you think about like when I was a kid, there was tons of cigarette ads. The automobile industry spends 20 billion a year on advertising. Most of the advertising involves driving that in real life would result in mass casualty, like speeding. You know, nobody is ever like stuck in traffic driving at a normal speed. It's always like, you know, basically dangerous driving. So this is heavily advertised, heavily promoted. And if you think about product placement, so a really common thing I noticed, I think starting with The Matrix, is like driving the wrong way. Like these exciting chase scenes where somebody in a car was driving the wrong way up a highway or things. And I noticed an increase in news reports of people doing that. So basically, we've got an industry spending $20 billion a year advertising and promoting unsafe driving and the purchase of an automobile as how you get security and comfort and status and all these things. Very similar to the tobacco industry. And then another area that I think would be really interesting to look at is the complete abdication of responsibility by NISTA. Basically, it's a completely captured agency. They really haven't done anything to rein in the automobile industry in a very long time.
Yeah, and they're only in the US, they're only rated for the safety of the people in the interior of the cars. Whereas in other countries, the safety ratings include people outside the cars as well.
Yeah, and the US slaughters its pedestrians. And you know, an example, in New York City and LA, both over half the deaths are people on foot. And remember, a person on foot imposes neither risks nor costs. They are 100% the victim of the situation. So the challenges in road safety is there's no obvious source of ongoing research funding. There's a potentially adversarial relationship with data holders. You know, so I'm a person whose job it is to get data from people. And if you've got police or, you know, NISTA or these organizations that have a vested interest in kind of counting things by vehicle miles traveled rather than per population, there's a potentially adversarial relationship there. There's powerful, organized, well-funded adversaries. You know, there's billions and billions and billions of dollars in DOTS, the Departments of Transportation, asphalt, auto, and oil, and police. And all of these industries have a vested interest in the status quo. There's public perception. I think that people don't ever question how we got the system we have. Why do we drive everywhere? Why do we count injuries and deaths from the point of view of the car? why do we accept 45,000 deaths a year and 6 million crashes a year and 3 million injuries a year? I don't think people really question that, and getting people to kind of say, hey, maybe it doesn't have to be this way. And because of the way we built, cars are often the only viable option. And that's what we're up against. Solutions. So I want to end on a happy note. Just to say we are who we've been waiting for. Like, nothing ever changes unless people like really try. So the first thing is to understand the magnitude of the problem. Like, our nation's transportation system is the thing that cranks out more child funerals than any other cause for the past 70 years. And these are traumatic, violent, sudden, catastrophic, life-altering injuries and deaths. And that they touch almost every life in the United States. The second is know the data, especially local data. So for whatever reason, if you think about drug trials, like, usually if a drug works in the UK, there's an assumption it works in the US, but cities don't think that way. They're like, we need proof that this drug works in California cities. We need proof that this drug works in our city. And so for whatever reason, cities are very insular in their thinking, and they don't really port evidence from similar cities to themselves. They need evidence from their own cities. So know the data, and especially your local data. And just a number for you to know for LA, over half the road deaths are people on foot. LA slaughters its pedestrians, number one. Number two, LA has one of the highest rates of CVD and asthma and basically cardiovascular injuries and deaths from particulate matter from cars in the country. It's particularly bad. So cars kill a lot of Angelinos, just know that. Be vocal, polite, and persistent. So, and this is something I'm really struggling with. I don't want to ever be combative or bitter or angry, but I just want to always point out the ways in which this is really harming people. And particularly, like, nobody wants to bury their kid. Ever. It really cranks out a lot of tragedies. International best practices, and this is really where the US is way behind. Like, we're worse than Russia, we're worse than any other country in Europe, we're worse than Asia. The international best practices are proven, low tech, low cost, easy to implement. Our dots make it hard. It's not hard. You can make a road safe by narrowing the lanes, putting in some bollards, putting in some rocks, putting in some Jersey barriers. Super cheap, super easy. You don't need $2 million worth of money to study it. It's easy to do. And then finally, think about how to reduce the dose of driving. Like, if you think about driving as a hazard, the solution is to really reduce the dose. That means reduce the speed, reduce the number of cars, reduce the size of cars, reduce the angle at which cars hit. Like, anything you can do to reduce the amount of kinetic energy, the number of those collisions, and the force of those collisions is going to improve outcomes. And finally, understand that you're taking on entrenched power, that there are people who have a very vested interest in the way things are. And that's not just people who, like DOTS and the oil industry and car companies, but also individuals. Like, it's what they know. And people get very upset if you try to inconvenience them in their car. Just try to help people think about, like, why is it this way? And what are the real costs of centering our entire civilization on cars? So that's it. Thank you very much.